Hi everyone, I'm Stella Macy, Talent Basin 1 at Philippine Advent College. For today, I will be performing a head-to-toe assessment or a complete physical examination. So prior to performing this procedure, we want to perform hand hygiene and gather all the equipments needed. And also, if there are curtains or doors in the room, you want to close them in order to provide privacy. Afterwards, we can now proceed to identifying the patient. Good morning, ma'am. I am Stella Mehitalan. I am your student nurse for today. So how do you want me to call you, ma'am? The purpose of the assessment is that I am here in order to perform a head-to-toe assessment or a complete physical examination, and we'll be starting this by obtaining your height, your weight, and by checking your vital signs. I will also be assessing your head, your neck, your facial features, your heart, your lungs, your abdomen, your lower and upper extremities, and also your neurological functionality. Why do we do this? We do this in order to ensure that there are no signs of abnormalities and that everything is normal, and if there are any scientific abnormalities, you're going to call back the patient in order to prevent further complication. If your patient have any questions, you can tell him or her that they can ask and check out the assessment. Okay, ma'am, so before we begin, I would like to ask you some few questions. Have you noticed any problem with your skin?
No, ma'am.
Any problems with your facial features?
None, ma'am.
Your visual and hearing?
No, ma'am.
Any problems with breathing?
None, ma'am.
Digestion?
No, ma'am.
Locomotion and movement? Problems in personal hygiene?
No, ma'am.
How about your emotional and mental safety? Have you been experiencing stress, anxiety?
None, ma'am.
So do you feel any pain right now?
No, ma'am.
Okay. So again, I'm going to assess your general status and we'll be starting upgrading your height, your weight, and afterward, then I'm going to check your vital signs. So I'm going to invite you to stand up and just step there so you would be able to obtain your weight. Now step on the main scale and remove your slippers for a while. So now I'm going to be checking her vital signs and we will be starting off with her temperature. Her temperature is 36.5, which is normal. Now we can proceed to obtaining her pulse rate. Ma'am, kindly give me your hand. Her pulse rate is 88 beats per minute, which is normal as well. We will proceed in obtaining her blood pressure. So ma'am, I will be putting this in your arm. This will feel a little tight for a while, but that is okay. Her blood pressure is 120/80. Now, we are going to proceed to palpating the skull, the ears, the nose, and the maxillary and frontal sinuses. But first, I'm going to wear a gloves, and after wearing it, you can now proceed to palpating the skull. Before we start, I'm going to wear a gloves first. That is how you wear your gloves. So ma'am, I'm going to touch your head and that will be okay. We are going to assess for any signs of bumps, lesions, or depressions in the skull. Ma'am, do you feel any pain? And you also want to proceed palpating the ears, the jaw, chin, going to the maxillary and frontal sinuses. Ma'am, do you feel any pain as I was touching you? Then after that, palpate the nose. After palpating, remove the gloves. As I was palpating, there were no signs of bumps, no signs of depression in the skull, so that is good. Afterwards, we are going to assess the eyes of the client. So first, you're going to check for corneal reflex, and you're going to shine up that line just to the midline of the nose of the client. What we are trying to assess is that the light should be reflected at the same spot of the eyes, because if it does not reflect at the same spot of the eyes, that indicates strabismus. So afterwards, we also want to assess the pupils of the client using the pilear pattern. So the pupils should be equal, it should be round, it should be reactive like reacting, accommodation, and reflexes. I'm going to shine a pen light on both pupil of the client. Let's see if they are reacting. Okay, so the pupils are equal and they are round. I'm going to get a pen in order to assess for accommodation reflex. I'm going to move this back towards in and away from your nose. Just follow. Great. Next, we are going to assess the 6 cardinal fields of A's. You just follow my fingers. Don't move your head. Just look at the middle. Okay, good. Now I'm going to perform a whisper test. I'm going to whisper something and you just have to repeat what I said. Apple. Basketball. Okay, good. Next, I will be assessing your difficulty in breathing. You can breathe through the other. Inhale, exhale. On this side, inhale, exhale. Do you find it difficult to breathe? No? Okay. Before we continue assessing the throat, let's check the ears first. My patient told me that she didn't clean her ears, and that is not hygienic. She should always clean her ears at least twice a week. Mom, I'm going to assess your throat, so kindly say for me as I'm going to assess it. Wider, Mom, Wider, As I was checking her throat, there is no sign of swelling, no sign of this infection on the tongue. So that's great. Now, we can move to the neck of the client. So first, you want to rotate the left and right carotid already. So you want to do this one at a time. There are no sign of enlargement of the thyroid, so that seems so good. We also want to assess for skin turgor. So there are no signs of skin turgor as well. Mom, we are going to check for your head movement. Kindly put your head up, down, left, right. Okay, thank you. Right now, I'm going to assess her heart, her lungs, her axilla, and her breast. This requires me to touch the patient. Ma'am, is it okay with you? Right now, we will inspect the back of the client for any signs of condition. Ma'am, kindly move right here. So I'm going to raise her shirt. Ma'am, is that would be okay with you? The first thing we want to do here, we would inspect the back of the client for any signs of conditions. As we all know, conditions commonly occur super bony areas. So after inspection, we want to palpate the back. So after palpating, we can now proceed to auscultation. So we want to auscultate the posterior thorax of the client for lung sound. So let me just raise this one like this. So after assessing the posterior thorax, you can now move to the anterior thorax of the client. So I will be doing the same thing. Let me just inspect for any signs of skin lesions. Okay, so there are no signs of skin lesions. However, I am taking of the redness on the thorax. After inspection, we want to proceed to palpation. Ma'am, kindly breathe in and breathe out. After that, you can also proceed to auscultation. So ma'am, kindly take a deep breath and breathe out. Breathe in, breathe out. Proceed to auscultating the heart. We want to hear the heartbeat using the diaphragm of the stethoscope. It seems like the patient has a normal heartbeat. It's all normal, so that's good. I'm going to proceed assessing your axilla and your breast area, so kindly sit straight for me and raise your arms like this. Now I'm going to invite you to lay on the bed in a supine position as I will be assessing your axilla, your breast, as well as your abdomen. The first thing that you do is to inspect the axilla and the breast area, then afterwards we can now proceed to palpation. Ma'am, can you raise your hand like this? So we want to palpate the axilla going to the breast. So we are trying to feel for any signs of bumps on the breast going to the other side. So do you feel any pain, ma'am?
No, ma'am.
Okay. So we also want to check for the discharges of the breast. So afterwards, we can now proceed to assessing the abdomen of the client. So the first thing that we want to do is to inspect the abdomen for any signs of discolorations. So as I am now inspecting the abdomen area or the abdominal area, everything seems clear. So the next thing that we want to do is to palpate the 4 quadrants of the abdomen. We are trying to assess for any signs of tenderness. After that, we can now proceed to auscultating the 4 quadrants of the abdomen. So we are going to look for the vowel sound. So after auscultating, we can now proceed to assessing the upper and lower extremities of the client. Okay, ma'am, so kindly raise your hand like this and also the others to this side and kindly shake it. Can you shake and wiggle your feet too? Okay, so I'm going to proceed to sharp and dull test. If you feel this would be the dull. And if you feel this would be the sharp. I'm going to do this to assess your sensation responses, so kindly close your eyes and tell me if it is dull or sharp. What is this, ma'am?
Sharp.
This?
Dull. Sharp. Dull. Sharp. Dull.
I'm going to do that to your feet as well. So ma'am, kindly give me your feet. Okay, ma'am, so tell me what is this?
Dull. Sharp. Dull. Sharp. Dull.
Okay, ma'am, thank you. To the other side, ma'am.
Dull. Sharp. Dull. Sharp.
Okay, thank you. After this, now I'm going to assess for capillary refill and edema on your hand and also to your knees for a while. So give me your hand, please. Now, I am going to assess for the capillary refill and repeat it to the other side. So again, if the nails immediately return to pink cover, that is normal. If it has a slow refill, that may indicate a respiratory or cardiovascular problem. And we want to take note of that, and we also want to assess for edema. So in assessing for edema, you want to apply pressure to the skin, and if it become indented, that is a sign of edema. But if the skin quickly returns to its original position or its original state, that would indicate absence of edema. We're going to do that to your feet as well. So apply alcohol after that. We can now proceed to the last part, to complete physical assessment, which is to assess the neurological functions of the client. So ma'am, I'm going to assess your neurological function. So can you state your name?
I'm Mary Christine H. Paderes,
Where do you live?
Lupoc, Labason, Zamboanga del Norte.
How old are you?
I'm 20 years old.
Do you know where we are right now, ma'am?
Yes.
So who is our president again, ma'am?
Rodrigo Duterte.
Okay, thank you. So ma'am, he is actually President Rodrigo Duterte. So after assessing all of that from head to toe, we are now done for the complete physical examination, and after that we can now proceed to documentation and referral. If we found abnormalities while doing the assessment, we can refer those abnormalities to other healthcare providers in order to have a further evaluation of the outcome.